Well, you've heard the saying, secrets don't make friends. Well, your teeth may actually be holding some secrets.
Well, let me explain. There are a number of important facts about basic dentistry that the average person doesn't know but should. So we are bringing in dentist Dr. Ted Grellner to enlighten us. Doctor, thank you so much for coming in.
Thank you very much.
And we've kind of been talking about this a few times throughout the show leading up to this, about that either or thing about, is it better to maybe brush more or to eat fewer sweets? Is this a black or white kind of thing?
My feeling is you're going to miss the same places every time you brush. So there's going to be bacteria in your teeth that when you have sweets, they're going to turn into acid that's going to eat away at your teeth. So the longer you have sugar in your mouth, the more they're going to eat and cause destruction. So, you know, to have processed sugar in the mouth is the problem. It's not the artificial sweeteners. This is the problem.
Oh.
So the key is actually to have sweets that are non-sticky, that will dissolve quickly. You know, not caramels. You know,
right.
but something that you can rinse out quickly, so it cuts down on the amount of time that the sugar is in the mouth and being turned into acid.
Okay.
Okay, so it's okay to have some sweets.
Sure,
Let's just be
of
mindful of what kind of sweets you're choosing for your oral health.
Exactly.
Now, okay, let's say we wake up one morning and we have some pain up here maybe. Now, does that mean that it's too late to get a filling if it's a cavity? Is that like we're too far gone?
You know, a toothache means that the bacteria in a cavity has started to infect the tooth. You can control that infection with an antibiotic temporarily, but ultimately you're going to need a root canal or to have the tooth out once it's gotten infected.
Oh, bummer.
I know.
Well, speaking of gum pain, and I know some people are thinking when you have that gum pain, is it meaning that we're getting down to the bone? Or, you know, kind of explain a little bit what that means or where we're at in that process once we feel that gum pain.
Well, gum pain can be a signal of gum infection, which can melt away the bone holding a tooth. But that can happen within days if you have a popcorn kernel stuck deeply in the gum.
Oh,
it's incredible the damage that can come on quickly. So as much as we love popcorn, you have to be very careful.
I just ate a bunch of kettle corn yesterday.
Uh-oh. I hope you flossed. We have a dentist on today. I hope you flossed.
I know.
Well, I know we talk about, you know, a lot of times when young people are getting braces, or we have to actually remove teeth. And so we're removing the teeth right from the bone. Does that get more difficult as we age?
The beauty of a teenager is the bone of a teenage jaw is soft, and that immature jawbone is going to harden considerably quickly within just 5 years. So nature's giving us an ideal opportunity to remove teeth that are going to be a problem later. It could be perhaps for braces, but more commonly it could be for wisdom teeth. Because wisdom teeth are going to be the teeth that are going to give you trouble, you know, over time. So that's a perfect opportunity that nature gives us to be able to do it when it's easiest, and the risk is less.
And I know we always say, you know, start going to the dentist with your children at a younger age. Don't wait until a certain age. And this is stuff we can kind of catch.
Sure.
Speaking of, I actually have two younger cousins who clench and grind their teeth, both of them, when they sleep.
And a co-host.
Yeah.
Oh, really? You
Yes,
too?
it's awful.
Okay, so is that kind of the clenching and the grinding, is that worse than maybe just our regular, everyday kind of wearing on our teeth?
Let me start by saying this is not one of my tools.
Okay, I hope not.
But the jaw, like a pliers, generates more force closest to the joint than it does further away. So it's possible that you can actually split your back teeth, the molar teeth, by the heavy pressures of clenching. So it's not the harmless habit that you once thought it was. Not wear of teeth is one thing, but if you split a tooth and it gets infected and has to be removed, you're losing a tooth prematurely.
I'm like checking.
To you.
I'm using my tongue to see if I have any cracks in my teeth right now. That terrifies me. So then what do people do? What's the solution?
Well,
for
a good
that?
prevention is have your dentist make you a heavy plastic night guard to wear at night to take those heavy clenching pressures off the teeth.
Okay, and now I know we're kind of looking at this right now, medical issues, you know, that we might be talking about, how do they affect maybe if we need some kind of surgery orally?
Well, that's an excellent question. If somebody has uncontrolled high blood pressure, you risk a stroke if you get treated with that pressure. You need to see your physician to have the blood pressure brought down, and that could take weeks to do. If you've had a recent heart attack, that damaged heart muscle is going to take sometimes 6 months to be able to repair before you can get routine dental care.
Okay.
Patients who are on osteoporosis medications to harden their bones, if they've been on it for too many years, before they can have any surgery done on the jawbone, they need to be off that medication sometimes for 6 to 12 months before they can have even something as simple as an extraction done, or the bone may not heal.
So what I'm really hearing, doctor, is that it is super important that we always maintain our oral health, but especially as we get older.
Well, it is, because as you get older, your medical status is going to deteriorate depending on how well you take care of yourself. And so if you have postponed a dental problem and now you've got a medical issue, you know, you may not be able to get that dental problem treated in an immediate fashion. It may have to be delayed. And there's one other thing as far as medical issues, very important for women, is pregnancy. The worst time to have a dental problem is when you're pregnant, because it limits when you can have it treated. It limits the antibiotics, pain medications, and anesthetics that you can have. So, you know, best thing is maintain your dental health before you get pregnant.
Pregnant, yeah.
Well, Dr. Ted, some really great advice today. Kind of made me think. So I feel like I'm going to go visit your website in a little bit. I want to thank you so much for taking the time to speak with us today.
I appreciate that. Thank you very much.
And to learn more about Dr. Grellner, just call 813-972-3478 or visit grellnerdds.com.